The Ebola epidemic in West Africa has been the worst in history and has claimed the lives of more than 11,300 people and infected more than 28,500 people from December 2013 to January 2016.
I did call the U.S. Army. The Army told me they were in Uganda and they will be back in February and they'll come over to Liberia and help us as soon as possible. So I called. They were already with the CDC in Sierra Leone. So they brought the primers, they brought everything I wanted, we needed, and we started a laboratory, my Roberts Fee at the Liberian Institute for Biomedical Research. That's how we started the work. It was done together, the CDC, the U.S. Army worked very close with me, and then we started doing the testing.
Liberia has been the worst hit, with more than 4,800 dead and 10,672 becoming infected, a fatality rate of 45%. The World Health Organization said that at the peak of transmission during August and September of 2014, Liberia was reporting between 300 and 400 new cases every week. Once the virus hit Monrovia, which is an urban center, there's about 1.4 million people living in Monrovia. Whereas in Guinea, the virus was more situated in the southeast region, which was more rural area. So that just knowing, and then the level of healthcare providers, so 50 physicians in the entire country. That was eye-popping. I think just being from Liberia, that was not a reality to me until just seeing it in how it related to us addressing Ebola.
She had just celebrated her birthday in July of 2014, and then she graduated from high school. So from July to August, somebody came in contact with the virus that lived, because they have a very big family, property. So somebody came in contact with the virus and brought the virus home. And then her father-in-law, my daughter's father-in-law, they kind of try to take care of the situation by themselves, afraid of the stigma, because the communities, other people have fear. So people try to take personal responsibility to try to mitigate the spread and the stigma associated with it. The family thought they could keep it. So while in that process, my grandson, being very close to the grandfather, got close to the grandfather who also had the virus. And then my grandson came in contact with the virus. My daughter taking care of that child to caught the virus. In the process, her mom came at the house and took her from the house. The mother also was a nurse. She had been quarantined before because she was taking care of somebody. So she thought she could easily take care of her daughter. So she took her daughter home. And my grandson died September 28th of 2014. And then she took, and then she, her little sister, and her mom came down with the virus. And then they were taken at EAWA to one of the quarantine center. The mother died on I think it was on the 10th of October. The little sister died on the 12th, and my daughter died on the 15th of October. I came out with this, I said, look, let me take the initiative to form something positive in my daughter's name. And then I come back and try to solicit funding to see how I can go back. The house that they live in, I want to go and restructure that particular house into an orphanage. If I can even help 10 children, that will bring some relief, to my pain, to my grief, that I can use it in a positive light. So by next week or so, I'll be launching a GoFundMe, and I'll be coming out to people to help.
Before the outbreak of the Ebola epidemic, Liberia had 50 doctors for its population of 4.3 million. The Liberia healthcare system, which was already among the weakest in the world, has now been decimated by the Ebola outbreak. Nearly 200 Liberian healthcare workers have died from Ebola, which represents 8% of all health workers in the country. To date, there where 500 healthcare workers reported to have died as a result of Ebola between the three countries.
The main success story was ownership. Initially, the ministry started sending people from Monrovia, from central level to go into these counties. And the community people weren't cooperating. So that was noted, and then they went back to the drawing board and came up with other strategies in collaboration with the community health department of the ministry. And what it did was to have influential people within the communities to serve as eye for the government, to serve as mouthpiece for the government. These are people whose community residents listen to. So once that was done, we saw huge surge in the number of cases that were reported, in people willingness to come out to be tested or to report if there was any such person in a community.
It wasn't until September 2014 in a report by Dr. Meltzer and Charisma Atkins, they actually released projections of where the Ebola crisis will end up if we did not have increased intervention. Basically what they said is that Ebola was doubling, the cases were doubling every 15 to 20 days in Liberia, as well as doubling every 30 to 40 days in Sierra Leone. So their worst case scenario, Ebola would actually, we would have about 500,000 cases. So with that was really when we knew that we needed to start getting ready and raising awareness and being a little bit more aggressive in soliciting the help of the international community. Abroad, the world was terrified and began to organize and send resources to the region. The Liberian Association of Michigan also organized to raise awareness locally about the virus.
We started to go on various television channels and radio stations to raise awareness to the community as at large. We started talking to community members, letting them know to call family members and give them information, the right information that we knew from the U.S. The community meeting was very intense. People seemed very confused because they didn't have the exact information. So what we did, we had health workers in our community. We reached out to some of the other African communities, people from Nigeria, Sierra Leone, because Sierra Leone is very close to Liberia, and they actually had the same problem. So we all got together, and some of the nurses and doctors and health workers came and they gave us a little more information. People came out and asked us what we needed. Even people in the community, friends at work or friends at school, were asking what can they do. People came and whatever they had, they brought it because they found out that we were shipping a container. So people came out and really supported us.
Adult Ebola survivors also face stigma and discrimination while accessing care now, as well as social and economic problems such as loss of work and housing. They also need general outpatient care and mental health services.
People tend to stigmatize you if you had Ebola or if somebody of yours had Ebola and you had contact with that person. And then the issue of being isolated, because once you start to follow the person and the person start to show signs and symptoms that will be later taught to the contact tracers, that person is taken out of his or home and placed in a special place, a special institution where they go for testing, further testing, and then if necessary, they start whatever relevant treatment that is available. And people, most of the times, people that came down with the disease were breadwinners, and they did not want to leave their families. They did not want to be isolated, and they had this issue of who's going to take care of my family while I'm here.
The Ebola virus is now calm. Guinea was declared Ebola-free on December 29, 2015. Liberia on January 14, 2016. and Sierra Leone is projected to be Ebola-free on March 17, 2016, if there are no new cases until then.
When I talked to a few of my friends, they just said that during the period, if they just heard an emergency sharing person going to the next maybe house or so, everybody was in fear. So, and there has not been a lot of emphasis played into going back to those communities that were hugely affected by the outbreak to see how they can help people to come in terms of the level of trauma and the stigma that was attached to it.
To help combat the virus, Liberia has expanded its treatment centers. Over the past months, a 150-bed clinic was erected in Bushra Island in Monrovia. Another 160-bed facility is staffed and run by Médecins Sans Frontières, and China has opened a state-of-the-art clinic outside Monrovia, a 100-bed clinic which is mostly staffed by Chinese medical and other personnel. JFK expanded its treatment center from 35 to 75 beds, and the U.S. opened the first of the 17 Ebola treatment facilities it is building in Liberia in Tubman'sburg.
On the ground, just before I left last week, we have people from University of Massachusetts and other institutions to be funded by the Health and Human Services so that we can build the infrastructure and get more scientists to work.
For an epidemic outbreak like Ebola, contact tracing is very, very important. So with that being set up and in full swing, we're gonna actually be in full control, and we have available resources. In addition to contact tracing, we have our labs up. Besides the reference lab, we have other labs that are situated in other counties. If I'm not mistaken, probably all of the 15 counties or more or less have laboratories for testing Ebola samples. So those are things that can impact the quick response to epidemics.
It might not be in the textbook. It's not going to be anywhere you and I can read, but it's going to come up in the future based on my experience. Very important to call it a dead end. Ebola is dead end. The animals is an animal disease. It comes to us as humans. We cannot transmit it except we get in contact directly with some secretion from people who got Ebola. But we're not part of that cycle, really. So we're at a dead end.
We were a little bit late on responding about Ebola. I think next time we'll be a little faster to respond instead of just saying, oh, we'll wait and see what happens. We'll actually get right on the ball.
And you start a process and you don't finish it, you have done nothing at all. Then you become part of that problem. But if you say, I will do this, and you do it, it's not so much of the money. It's the fact that you identify at that immediate point when someone actually in need. You get him in, then you have done that impact. Then you have created that impact. Having said that, it is still not late. You still got people out there who need help.
You're broken down and tired.
Today, many people continue to suffer, particularly those children whose lives have been left even more vulnerable by the virus. The nearly 23,000 children who lost one or both parents to Ebola in Guinea, Liberia, and Sierra Leone will continue to need care and support. These include the more than 1,260 children who have survived the disease across the three countries and are facing challenges, both medical and social, as many struggle to be accepted back into their communities. Now that the world is no longer watching, who will respond to the silent cries?
And I rise up, I like the waves, I rise up, in spite of the ache, I rise up, and I do it 1,000 times again. You